The hospital room on the fourth floor was quiet except for the rhythmic beep of monitors. Dr. Marcus Williams stood outside room 412, reviewing the patient chart on his tablet. Post-operative day 2, gallbladder removal, recovery progressing normally. This should be a straightforward consultation. He'd been chief of surgery at Metropolitan Hospital for 3 years, but he still made rounds personally when his schedule allowed. It kept him connected to patients, reminded him why he'd spent a decade in medical school and residency. Today, he was covering for Dr. Peterson, who was at a conference. Marcus knocked twice and entered, his white coat crisp, stethoscope around his neck, ID badge clearly visible. "Good morning, Mrs. Whitmore. I'm Dr. Williams. I'll be checking on your recovery today." The woman in the bed looked up from her phone. Linda Whitmore, 52, had the kind of appearance that suggested country club memberships and HOA board positions. Perfectly styled blonde hair despite 2 days in a hospital bed, manicured nails, and an expression that immediately telegraphed displeasure. "Where's Dr. Peterson?" she asked, not greeting him. "Dr. Peterson is at a surgical conference in Boston. I'm covering his patients this week. How are you feeling?" Linda's eyes traveled over Marcus with undisguised skepticism. He was used to this look, the double take when patients expected someone different. Usually, he let his competence speak for itself. Usually, patients moved past their initial reaction quickly. Linda was not usual. "I don't think so," she said flatly. Marcus paused, stylus hovering over his tablet. "I'm sorry?" "I said I don't think so." "I want my actual doctor, not—" She waved her hand vaguely at him. "Whoever you are." Marcus took a breath, maintaining his professional composure. "Mrs. Whitmore, I assure you, I'm fully qualified to oversee your care. I've reviewed your surgical notes, your recovery is progressing well, and I'm sure you're very nice," Linda interrupted, her tone suggesting she thought nothing of the sort. "But I specifically chose Dr. Peterson. I did my research. I picked the best surgeon. I didn't agree to have some random person wander in here." "I'm not random," Marcus said calmly. "I'm the chief of surgery for this hospital. Dr. Peterson reports to me." Linda's expression didn't change. "I don't care what title they gave you. I want a real doctor. Someone qualified." The words hung in the air. Marcus felt the familiar tightness in his chest, the combination of frustration and profound weariness that came from being questioned purely because of his skin color. "I am a real doctor, Mrs. Whitmore. I have my medical degree from Johns Hopkins, completed my surgical residency at Massachusetts General, and I've performed over 3,000 successful surgeries. I'm more than qualified to check your incision site and review your recovery." Linda reached for the call button. "We'll see what the nurse has to say about this." Within 30 seconds, a nurse appeared. Jennifer Park, who'd worked with Marcus for 2 years and had assisted on hundreds of his surgeries. "Yes, Mrs. Whitmore?" Jennifer asked. Linda pointed at Marcus. "This person claims to be a doctor." "I want Dr. Peterson. I want someone who actually knows what they're doing." Jennifer's eyes widened slightly. She glanced at Marcus, who gave her a subtle headshake, a signal he'd handle this himself. "Mrs. Whitmore," Jennifer said carefully, "Dr. Williams is the chief of surgery. He's one of the most respected surgeons in the state. You're actually receiving care from the best possible—" "I don't believe that for a second," Linda snapped. "Look at him. He's probably an orderly or something pretending to be a doctor. I've heard about this kind of thing on the news." Marcus's jaw tightened imperceptibly. In 15 years of practicing medicine, he'd faced skepticism, had his credentials questioned, been mistaken for custodial staff more times than he could count. But this woman was suggesting he was actively impersonating a physician. "Mrs. Whitmore," Marcus said, his voice deadly calm, "I need to make something very clear. I am Dr. Marcus Williams. I am the chief of surgery at this hospital. My credentials are posted on the hospital website, verified by the State Medical Board, and available for your review at any time." He pulled his ID badge forward, showing it clearly. "This badge isn't fake. My medical degree isn't fraudulent. And your insistence that I'm somehow unqualified to provide you medical care is not based on anything except the color of my skin." Linda's face flushed. "How dare you play the race card? I'm not racist, I just want a competent doctor. You've been told repeatedly that I am competent. More than competent. You've been shown my credentials. You've been informed of my position. What exactly would convince you, Mrs. Whitmore? What does a real doctor look like to you?" Someone who looks professional. I'm wearing a white coat, surgical scrubs, a hospital ID badge, and a stethoscope. What about my appearance isn't professional? Linda faltered, realizing she'd backed herself into a corner. I want Dr. Peterson. Dr. Peterson, who is white, Marcus said bluntly. Let's be honest about what's happening here. This is ridiculous. Linda's voice rose. I'm a paying patient. I have rights. I don't have to accept treatment from anyone I'm not comfortable with. You're absolutely right, Marcus agreed. You have the right to refuse treatment from any physician. But let's be clear about why you're refusing. It's not about qualifications. It's not about experience. It's about race. He turned to Jennifer. Please document in the patient chart that Mrs. Whitmore has refused examination by the covering physician. Note that she was informed of my credentials and position, and that her refusal appears to be based on racial discrimination. Wait, Linda said quickly. You can't write that. You're putting words in my mouth. I'm documenting facts. You refused care from a qualified physician after being informed of his credentials. If that's not accurate, please explain your reasoning. Linda opened her mouth, closed it, opened it again. It's not about that. Just what, Mrs. Whitmore? A new voice interrupted from the doorway. Is there a problem here? Dr. Sandra Mitchell, the hospital's chief of medicine and Marcus's colleague for 5 years, stood in the entrance. She'd clearly been passing by and heard the raised voices. Linda's face lit up. Yes! Thank God, an actual doctor. This man has been harassing me. Dr. Williams is not this man. Sandra interrupted, her tone glacial. He's the chief of surgery and one of the finest physicians I've ever worked with. And if he's in your room, it's because he's trying to provide you with medical care that, frankly, you don't deserve given how you're treating him. Linda's mouth fell open. Excuse me? Sandra walked fully into the room, her white coat bearing the hospital logo and her name embroidered clearly. I'm Dr. Mitchell, chief of medicine. I oversee all physicians in this hospital. That includes Dr. Williams, and I can tell you without hesitation that if I needed surgery, he'd be my first choice. But I didn't choose him, Linda protested. I chose Dr. Peterson, who is unavailable. So you're receiving care from someone even more qualified. Most patients would consider that fortunate. I have the right to choose my doctor. You have the right to choose within reason, Sandra corrected. What you don't have is the right to discriminate based on race. What you're doing right now is refusing treatment from a highly qualified physician for no medical reason whatsoever. Linda's face had gone from flushed to pale. Let me make this simple, Sandra continued. Dr. Williams is the only surgeon covering Dr. Peterson's patients this week. If you refuse his care, you'll have no surgical oversight. Do you understand what that means? You can't do that. We're not doing anything. You're choosing to refuse care. That's your right. But consequences come with choices. Marcus watched the interaction with a mixture of appreciation and frustration. He was grateful for Sandra's support, but exhausted by needing it. How many times would he have to prove himself? How many decades would he practice medicine before his credentials spoke louder than his skin color? Linda looked between them, realizing she'd lost. Fine. He can examine me, but I'm filing a complaint. About what? Marcus asked. About being offered care from a qualified physician? About being called out for racial discrimination? Please go ahead. I'd love to see that complaint in writing. He approached the bed, pulling on gloves. Now, if you'll allow me to actually do my job, I need to check your surgical site. The incision should be healing well, but I need to verify there's no infection or complications. Linda lay back stiffly, her jaw tight with resentment. Marcus performed his examination with the same care and precision he gave every patient, regardless of how they treated him. The incision was healing perfectly. No signs of infection, recovery on track. Everything looks good, he said, removing his gloves. You should be discharged tomorrow if your progress continues. I'll have the nurse provide you with post-operative care instructions. That's it? Linda asked. That's it. Your surgery was successful, your recovery is normal, and you're healing well. Despite your belief that I'm unqualified, it turns out I can actually read a medical chart and assess a surgical site. The sarcasm was slight, but present. Sandra gave him a look that said she understood but cautioned restraint. Marcus continued. Is there anything else you need from your allegedly incompetent doctor? Linda pressed her lips together. No. Then I'll continue my rounds. Have a good morning, Mrs. Whitmore. He walked out, Sandra following. Once they were out of earshot, she placed a hand on his arm. "I'm sorry you had to deal with that." Marcus shook his head. "It's not your fault. It shouldn't happen at all. Not in 2024, not in a hospital, not anywhere. But it does happen." Regularly. Marcus pulled off his stethoscope, running a hand over his face. "I'm the chief of surgery. I have 2 medical degrees, board certifications, published research, and I still get mistaken for custodial staff, still get my credentials questioned, still have to prove myself in ways white doctors never do." Sandra's expression was pained. "What do you need?" "How can I support you?" "You just did. But, Sandra, you shouldn't have to. That's the exhausting part, always needing someone to vouch for me, validate me, confirm that yes, the black doctor is actually a doctor. I know." They stood in silence for a moment, the weight of institutional racism hanging between them, acknowledged but unchanging, visible but unmovable. Marcus took a breath. "I need to finish rounds. I have 6 more patients." "Do you want me to come with you?" "In case—" "No," Marcus said firmly, but not unkindly. "If I need a white colleague to validate my existence as a physician, then what's the point?" Sandra nodded, understanding. Marcus continued his rounds, the interaction with Linda Whitmore following him like a shadow. Each patient he saw, he wondered, are they questioning me too? Do they trust me, or are they just being polite? Would they prefer a different doctor if they felt they could ask? The rest of his rounds passed without incident, but the damage was done. That familiar exhaustion had settled in, the kind that came not from hard work, but from constantly defending his right to exist in his chosen profession. That evening, Marcus sat in his office reviewing surgical schedules. A knock interrupted him. Jennifer Park stood in the doorway. "Dr. Williams? Do you have a minute?" "Of course." "Come in." Jennifer sat across from him, looking uncomfortable. "I wanted to apologize for this morning. I should have shut down Mrs. Whitmore's behavior immediately instead of trying to be diplomatic." Marcus gave her a slight smile. "You were trying to maintain patient relations." "I understand." "No, it was wrong. You shouldn't have had to defend your credentials. I should have made it clear that her behavior was unacceptable. Jennifer, you're a nurse. You're in a difficult position. Hospital politics are complicated. That's not an excuse. You mentor residents, you've trained half the surgical staff, you save lives every day, and you had to stand there and justify your existence to a patient who decided you were unqualified based on absolutely nothing." Marcus was quiet for a moment. "Do you know how many times this has happened?" "Too many. Try dozens. Maybe hundreds if you count every microaggression, every surprise when I introduce myself as a doctor, every time someone asks if I'm one of the good ones. It's constant, Jennifer, and it's exhausting." She looked at him with genuine distress. "What can we do? The staff, I mean. How do we make this better?" Marcus considered the question. "Call it out. Every time. Don't be diplomatic when someone is being discriminatory. Don't try to smooth things over. Make it clear that behavior like Mrs. Whitmore's is unacceptable, even if it makes patients uncomfortable, especially if it makes them uncomfortable. Maybe if enough people face consequences for that behavior, it'll start to change." Jennifer nodded. "I'll do better. I promise." After she left, Marcus sat alone in his office. His medical degrees hung on the wall: Johns Hopkins, Massachusetts General, board certifications, awards, commendations. A wall full of proof that he belonged here. But Linda Whitmore hadn't cared about any of it. She'd looked at his face and decided he was unqualified. No amount of education, experience, or expertise mattered more than her preconceptions. His phone buzzed, a text from his wife, Diana. "How was your day?" He started to type, "Fine," then stopped, deleted it, typed the truth. "Had a patient refuse treatment because I'm black." Same old story. Her response came immediately. "I'm so sorry." "Want to talk about it tonight?" "Always." The next morning, Marcus arrived early for surgery. He had 2 procedures scheduled, a complex gallbladder removal and a hernia repair. The OR was his sanctuary, the one place where skill was undeniable, where the work spoke for itself. His first patient was already prepped. Marcus introduced himself, half expecting the same skepticism he'd faced yesterday. "Dr. Williams," the patient said, a middle-aged man named Robert. "I requested you specifically. My brother had surgery with you 3 years ago. Said you were the best surgeon he'd ever met. The compliment landed like a balm on yesterday's wound. Thank you. I appreciate your confidence. Are you kidding? After what I heard happened yesterday with that woman on the 4th floor, I wanted to make sure you knew not everyone is like that. Marcus paused mid-review of the surgical notes. You heard about that? Hospital gossip travels fast. What she did was wrong. Just wanted you to know. After Robert was under anesthesia and Marcus was scrubbed in, he stood over the operating table. This was where everything else fell away. No discrimination, no doubt, no exhaustion. Just precision, focus, skill. The surgery went flawlessly. Every cut exactly where it needed to be. Every suture perfectly placed. This was what he was meant to do, but as he was closing, his mind drifted back to Linda Whitmore. Was she discharged yet? Did she leave still believing he was unqualified? Would she tell people about the random person who tried to be her doctor? After the second surgery, equally successful, Marcus changed out of his scrubs. He should have felt accomplished. 2 perfect operations, patients healthy, lives improved. Instead, he felt tired, the kind of tired that sleep wouldn't fix. Dr. Mitchell appeared in the surgeon's lounge. Marcus, do you have a minute? He followed her to her office where she closed the door and gestured for him to sit. Mrs. Whitmore filed a complaint. Marcus almost laughed. Of course she did. It's absurd. Completely absurd. She's claiming you were unprofessional, that you accused her of racism without cause, that you refused to provide adequate care. All of which is demonstrably false. Jennifer documented everything. You witnessed half of it. I know, and the complaint will be dismissed. But, Marcus, Sandra hesitated. This isn't the first complaint like this you've received. I'm aware. The hospital administration is starting to notice a pattern. Marcus felt ice in his stomach. A pattern of patients being racist toward me. They're not seeing it that way. They're seeing multiple patient complaints against one surgeon. Are you kidding me? Marcus stood. I'm being penalized because patients discriminate against me? I'm not saying it's right. I'm saying it's how they're viewing it. They're worried about liability, about patient satisfaction scores. Patient satisfaction scores? So if racists don't like me, I'm the problem? That's not what I'm saying. That's exactly what you're saying. Marcus's composure finally cracked. I'm one of the best surgeons in this hospital. My success rates are higher than average. My complication rates are lower. My patients recover faster. But because some of them can't handle being treated by a black doctor, I'm getting flagged by administration. Sandra looked pained. I'm fighting this. I want you to know that. I'm pushing back hard. But it's still happening. Yes. Marcus sat back down, the fight draining out of him. What do they want me to do? Be whiter? Be more palatable? Apologize for making racists uncomfortable? They want you to de-escalate these situations. De-escalate. Right. When someone refuses to accept that I'm a doctor, I should just smile and take it. I didn't say I agree with them. Marcus looked at his colleague, his friend, and saw genuine distress. She was trying, but trying wasn't enough. Sandra, I've spent my entire career de-escalating, being twice as good to be considered half as qualified, staying calm when patients treat me like I'm invisible, proving myself over and over and over. How much more can I de-escalate? She had no answer. That night, Marcus sat with Diana in their living room. She listened as he recounted everything, the patient, the complaint, the administration's concerns. Maybe it's time to consider other options, she said quietly. Like what? Leaving medicine? Of course not. But there are hospitals that would value you properly, research institutions, teaching positions. You don't have to stay somewhere that doesn't appreciate you. Marcus stared at his hands, the hands that had performed thousands of successful surgeries, that had saved countless lives. If I leave, aren't I letting them win? If you stay and it destroys you, they win anyway. 3 days later, Marcus received an email from the hospital CEO requesting a meeting. He knew what was coming, a conversation about professionalism, about patient relations, about finding ways to avoid these situations. He walked into the CEO's office prepared to defend himself once again, but what he found surprised him. The CEO, Richard Torres, gestured to a chair. Dr. Williams, thank you for coming. I want to start by apologizing. Marcus blinked. Apologizing? I've been reviewing the complaints against you. All of them. And I've also been reviewing your record, surgical outcomes, patient recovery rates, peer evaluations, everything. He pulled up data on his computer screen. Your surgical success rate is 98.7%, Hospital average is 94.2%. Your post-operative complication rate is 40% lower than the department average. Patient recovery times under your care are significantly shorter. Marcus waited, unsure where this was going. Every single complaint against you has one thing in common, Torres continued. They all come from patients who questioned your qualifications before you even examined them. Not one complaint is about actual medical care. I could have told you that. I know, and I should have seen it sooner. Dr. Williams, you're one of the best surgeons we have, maybe the best, and instead of protecting you from discrimination, we've been treating you like the problem. Marcus felt something shift in his chest. What are you saying? I'm saying the hospital is implementing new policies. Clear protocols for handling patients who refuse care based on discriminatory reasons. Mandatory implicit bias training for all staff. And a formal apology to you for not addressing this sooner. That's unexpected. It shouldn't be. You deserve to practice medicine without constantly defending your right to do so. Torres leaned forward. I can't undo the harm that's been done. But I can make sure it doesn't continue. For the first time in days, Marcus felt something like hope. The changes weren't immediate, but they were real. Staff training began. Policies were updated. And when the next patient questioned Marcus's credentials, a nurse shut it down immediately. Dr. Williams is our chief of surgery and one of the finest physicians in the state. If you're not comfortable with that, we can help you transfer to another facility. The patient accepted his care. 6 months later, Marcus stood before a medical conference sharing his experiences with discrimination in healthcare. The room was packed with doctors of all backgrounds, many nodding along with recognition. Excellence should speak for itself, Marcus concluded, but in a system built on bias, even excellence gets questioned. We don't fix this by being better doctors. We fix it by demanding better systems, by calling out discrimination, by refusing to accept that patients have the right to reject care based on race. The applause was sustained and genuine. Later, a young black medical student approached him. Dr. Williams, I'm starting my residency next year. I'm terrified of facing what you described. Marcus looked at the student, bright-eyed, hopeful, already bracing for battles that shouldn't exist. You will face it, Marcus said honestly. But you don't have to face it alone. Build your support system, document everything, and never let anyone make you question whether you belong in medicine. If you earned that white coat, you belong. The student nodded, determination replacing fear. That night, Marcus returned home to Diana. How did it go? She asked. I told the truth. About all of it. Good. Someone needs to. Marcus pulled her close, grateful for her constant support. The battle wasn't over, might never be over, but he was still standing, still practicing medicine, still saving lives, and that, he decided, was victory enough. If this story resonated with you, remember, discrimination in healthcare isn't just wrong, it's dangerous. Every patient deserves quality care, every doctor deserves respect, and systems that allow bias to flourish must be dismantled. Share this with someone in healthcare. Remind them that excellence should be recognized regardless of who demonstrates it, and demand better from institutions that claim to care about patient welfare while tolerating discrimination. Subscribe to Real Justice Stories for more tales of resilience, systemic change, and the courage it takes to demand dignity in spaces that weren't built for you. Thank you for watching. Remember, judge doctors by their skill, not their skin. Question credentials if you must, but question them equally. And if you witness discrimination, speak up. Silence protects the wrong people.